Hello, I'm Anat Loewenstein, and I will talk about home monitoring with home OCT. These are my financial disclosures, and these are my co-authors for this study. I will show you in this talk that information generated by teleconnected OCT in our patient homes has the potential to support current retinal disease management and any future evolution in patients' monitoring, drug selection and dosing, as well as patient outcomes. A home OCT has the potential to personalize exudative AMD management using at-home OCT monitoring to catch and treat wet days as soon as they happen by providing patients and physicians with unique inter-visit disease knowledge. This has the benefit to avoid undertreatment and improve visual acuity outcome, while at the same time reducing treatment burden, increasing patient satisfaction, and reducing cost. The COVID-19 pandemic did highlight the need for such remote patient monitoring. For a home OCT system to be effective, it needs to answer a few parameters, and we will deal with them at this talk. I'm going to show you the result of the study aimed to evaluate self-operability of Notal OCT by elderly patients with AMD. We would like to show you a comparison of investor image assessment for disease activity between the Notal OCT and commercial in-office OCT devices. It was a prospective IRB-approved clinical trial that included consecutive eyes with neovascular and non-neovascular AMD. Patients were imaged in a non-dilated manner on a commercial OCT, be it Cirrus or Spectralis, and following a 2-minute tutorial, they self-operated the Notal OCT to capture OCT images of their own eyes. Images from the Notal OCT were then compared to commercial OCT images by a masked reader for presence of intra and or subretinal fluid in the central 10 degrees of the macula. We had 2 investigational devices. One is the prototype and the other is the commercial form. Study population included more than 500 eyes and who completed more than 800 Notal OCT images. Patient characteristics in both versions included a pretty good median visual acuity, but with a range of visual acuities that were not as good. Most patients had neovascular macular degeneration, but there was a quarter that had intermediate AMD. For both versions of the technology, most of the patients agreed or strongly agreed that the technology is very simple and comfortable, and that was for both versions of the technology. The positive percent agreement and negative percent agreement of the Notal OCT, the first version with the commercial OCT, were more than 90% for fluid, for subretinal fluid, and for intraretinal fluid. Similar results were achieved also for the Notal version 3 of the OCT. Here you can see the excellent image quality as compared between the Spectralis, which is of course excellent, and to Notal OCT version 3. You can see another example with a large amount of fluid. I want to show you one longitudinal case. A 82 patient was neovascular macular degeneration in the right eye. At baseline, when he started using the technology, he had a very minute amount of fluid at the level of picoliters, 18 picoliters, but that was detected by the Notal OCT and shown on the subretinal fluid map. As you can see here, after a few days, you can see a noticeable, significant increase to 18 nanoliters. A few more days, you can see an increase to 124 nanoliters, a 7-fold increase. Patient is treated, and you can see the decrease after only 4 days of treatment, establishing the excellent treatment effect. So the Notal home OCT testing gives new insight into retinal fluid dynamics with new markers of disease activity, patterns of fluid distribution, as well as fluid volumes, as you can see summarized in this slide. You can see the image quality comparison in this longitudinal case between the Notal OCT version 3 and the Spectralis. So we showed in this clinical trial that the patients were able to self-operate the Notal OCT, even though we are dealing with a very elderly patient population. 88 and 93 of the eyes, respectively, on the version 2.5 and version 3, were able to successfully self-image on the Notal OCT. The patient's feedback on device usability was consistently positive, and the device does meet the requirements for successful patient self-imaging. Positive and negative % agreement of fluid identification in at least one of 3 consecutive Notal OCT version 3 self-images compared to commercial in-office OCT, 97% and 95% respectively. The Notal OCT does meet the requirements to produce high-quality images suitable for reliable identification of retinal field by human graders. The low-cost patient self-operated OCT device may assist in monitoring patients with neovascular macular degeneration at home. Information generated by teleconnected OCT can assist in monitoring patients' drug selection and dosing and improving patient outcome. Thank you for your attention.